Well, thank you very much, Carly, and welcome everyone. I'm delighted to be moderating this panel. We have three excellent speakers on this subject. And as Carly was saying, the whole kind of technology in this area tends to divide into three areas. There's the kind of contact tracing, the symptom tracking, and the immunity passports. And we're really going to be focusing on the third of those. Do these passports actually work? What are the concerns that we have about them? And what we should be thinking more generally, holistically, about whether they work and as part of a kind of broader system of technology. I'll introduce our three speakers today. Professor Sir Jonathan Montgomery, who is an expert in healthcare law at UCL. He's also the chair of the Oxford University Hospitals, who has both experience of the kind of academic area and also the practical implications of dealing with healthcare during this crisis. Dr. Claire Craig, who is Provost of the Queen's College, Oxford, who has an incredibly rich and varied background in this area as well. She is a member of the AI Council. She has worked with the Royal Society on a number of their reports. She's worked at McKinsey, and she has also written a book, I believe, called How Does Government Listen to Scientists? I'm very interested in the answer to that question. And finally, we have Husayn Kassai, who is the chief executive of a very interesting startup called Onfido that does background checks and identity verification. So three very different perspectives on this subject. I'm going to start with you, first of all, Jonathan. How do you view this subject? First of all, can immunity passports work well, do you think? And if so, what are the concerns and the opportunities that we ought to associate with this area?
Well, thanks, John, and good afternoon, everybody. I guess there are four clusters of concerns that I want to raise as part of the discussion. First of all, the way in which immunity passports will oversimplify complex science. Secondly, the way we take a specific data point and we create out of it an enduring and generic status. Thirdly, the way in which, in practice, health status gets linked with stigma and discrimination. And then just touch at the end in some of the political challenges about how we might go about deciding whether we want to go into that world. So first of all, we need to recognise that the World Health Organization has cautioned us against the use of immunity certificates, and it's done that for two main reasons. First of all, concerns about the accuracy of the tests that are currently available in detecting antibodies. And secondly, the uncertainty about what it means to have antibodies and whether or not those people with antibodies are less likely to succumb to a second infection of COVID. So the position basically is that we don't really know who might be immune, and we don't really know what immunity means. And they feel like pretty decisive arguments against the use at the moment. But of course, we can imagine that the science will become more reliable. And we can therefore contemplate if it did overcome those problems that the World Health Organization currently identifies, would we want to move into immunity certification? But even if it becomes more reliable, it'll still remain complex. The results of our tests are plotted onto a continuum, but we aim to make them into a classification. So the concentration of antibodies that requires before we classify a test as positive sticks it on a scale, and then we make a pass-fail type of binary classification. We gloss over the complexity if we move to passports. There's nothing new about that. I take an eye test to see whether I'm safe to drive. My short-sightedness is a matter of degree, but there's a cutoff that we use to classify me as either fit to drive or not fit to drive. So we take a specific clinical test and we convert it into my status as a driver. Of course, there's a big difference. With my eye test, I can correct my unsafe status, put my contact lenses in, fix myself, and I'm safe to drive. And we may well find that comes to us with COVID as we achieve, if we hopefully do, a vaccine. We may be able to correct the lack of immune status, not by getting the disease, but by having an effective vaccine. So we're still doing something that has uncertainty, and we're creating categories, but we're doing it in a way that's very different to clinical care. So if I have the test for COVID in the clinical context, it's aimed to give me personal advice on treatment and whether I should consider particular situations as specifically risky. And it's not considered in isolation. The ambiguity of the test result is partly corrected by combining it with other risk and mitigation factors. And typically, when you see apps playing a passporting function, such as in China, they combine test results with location, travel data, the people I've been in contact with, my temperature, my other health backgrounds, not just my immunity. And that takes the test out of isolation and creates a form of health journey. And that might make sense when I'm aligning my interests with the interests of the people inviting me, as with my personal health. But of course, with immunity status and certification, we're getting ourselves into the area of competing interests. My status might open or close the door to my right to work or my right to travel. And we shouldn't assume that it's always a good thing to be immune. It might be if my immunity status suggests that it's safe to do so, my employer is going to demand that I take risks I really don't want to take. For example, to go and work with COVID positive patients and perhaps to put my family at risk by the risk of my getting a second bout of the infection. So whether or not we think immunity certification matters obviously depends a lot on what follows from the status. The accuracy of the status is one thing, its implication is something different. And here, history suggests that we should be very concerned about the creation of stigma and discrimination. HIV taught us how status, even just the status of having had a test, excluded some people from work, irrespective of any actual risk. It affected the availability of life assurance and therefore their access to mortgages and housing. Immunity status historically has been used to determine not just whether you're safe to work, but actually whether you are employable. It's been used to determine your capacity to marry the person of your choosing. If you look back at yellow fever status in the United States of America, it was even put as a mark of divine favor if you had the right immune status. And it certainly served to exacerbate inequalities, something that we know that COVID-19 can do without any help from immunity passports. So if we do take the step towards immunity certification, we also need alongside it to think about necessary anti-discrimination provisions, compensatory adjustments for those we are asking to behave differently in the public interest to stop them being adversely affected. Maybe prohibitions on the use of immunity status in contexts where it's not appropriate, in the way that we do with genetic testing and insurance. So we have a series of challenges around the uncertainty of the science, the creation of the status and the meaning of the status. And we're going to need to decide whether that's the world that we want to live in. So if you imagine the sort of experiment that John Rawls suggested we might use for these challenges, you sit behind a veil of ignorance and you're designing the society you want to live in. You don't know your COVID status. It'll be allocated to you in a random process. Would you choose to live in a world where that status determine your chances of leading the life you hope for, or would you prefer to remain in ignorance? And we have to actually undertake that feat of imagination in a world like our own, where COVID status is not actually randomly allocated. So I leave you with the question whether that onerous citizenship of COVID status is the one that you would choose to enter, or whether you prefer to live in a world without that particular type of certificate. Thank you very much for your attention.
Thank you very much, Jonathan. And just before we move on, how would you answer that question yourself?
So at present, I'm pretty clear that it doesn't create any particularly useful information. It will distort our ability to decide who should be doing what, and we should be focusing much more on mitigations than status. I'll reserve until the end of the Q&A section whether I can be shifted from that view.
Okay, very good. Claire, can I come on to you? What are your concerns and what do you think about the opportunities in immunity certification as well?
Yeah. Thank you. What I wanted to draw on was a couple of strands. One is work that the Royal Society did on public dialogue around AI and its various applications, and the other is by inference from the kinds of discussions and challenges that societies have faced about new and novel and potentially risky but also beneficial areas of science elsewhere, GM, for example, or stem cells. And the first thing is, if the aim is well-founded public decision-making, then alongside the questions of technology and of science, and of course we've got two particularly big areas of uncertainty here. We've got the questions of immunity, and we've also got all the challenges around technologies, data sharing and so on that might support some sort of electronic-based passporting system. So we've got two really big sets of issues. But even as it were, leaving the technological and scientific challenges, if public decision-making is well-founded and draws on the kind of considerations that people of mixed socioeconomic, mixed types of backgrounds really are concerned about, then what you find is if you give groups of people time and the possibility to talk with experts on an equal footing, if you like, then their responses are always, first of all, incredibly nuanced and sophisticated in ways that often surprise the experts, in inverted commas, but also that they're really contextualized. And I think it was you, John, who said we would talk about systems of technology. The responses to the technology are not, as it were, responses just to the technology. They're always about the social, behavioural, governance systems in which they're embedded. So the question of immunity passports becomes a much wider one about who is authorised to make decisions, who's holding knowledge, who's holding data, who's responsible, and what kind of reparation there might be, or what kind of consequences there are for failures. People, by the way, always expect systems to fail because they know that they do, but it's what happens when there's a failure, of what kind. So very contextualized responses. Then that feeds into the fact, though, that another of the sort of issues that I think we're likely to face here is a kind of lightning rod effect. In other words, because there isn't time for everybody to engage with everything in terms of the science and the technology, at the very sort of top level of public and politics, there are kind of lightning rod phrases and issues that will sort of characterize and may distort the debate, if you like. So, for example, the question of whether software that supports different types of widely used app is centralized or decentralized is important, but it's probably not the only question that will determine whether or not people are comfortable with it, and indeed whether or not it is safe. There'll be many other things around it, and sometimes you can see public debate get kind of sidetracked. And then my final point also comes from work with very different scientific disciplines and humanities disciplines around identity, which is to remember that it's quite easy, because we often feel our identities both kind of quite viscerally as a singular thing. In fact, we're living with multiple aspects of our identities to the fore, depending on whether we're with friends or professionally or with family or whatever. And so part of the skill in designing systems that can be robust and useful, but also acceptable, is to make sure that you only focus on attributes of identity that matter for the purpose in hand. So, for example, it might be possible to test whether somebody was immune or had an immunity certificate if the science was as advanced as Jonathan has said. But you could do that without, as it were, needing to know anything else about them. So you'd simply need to know whether they have that attribute or not. And that's quite a different sort of debate to have from the wider ones about data sharing and identity more broadly.
Great, thank you very much, Claire. I just have one immediate question for you, which is, I mean, you have experience of working in Whitehall, and at the moment there clearly is a real sense of urgency that they have to address this crisis now, and that we all agree that there should be a better deliberation about this and everything ought to be considered. But there is a real urgency to try to deal with this crisis. How do we square the urgency of trying to take action to mitigate the effects of this pandemic at the same time as doing it in a responsible way that doesn't erode the trust?
I think there's at least there's probably 3 stages to that. So sometimes in government, and I was involved in civil emergencies from time to time, sometimes there has to be a decision taken immediately, at which point you have to use inference from what we know about how people might think about similar instances, and that's available quite straightforwardly. The second is that deliberation doesn't take that long, and some of the decisions that we're talking about, the science itself, as Jonathan was saying, will take a little while to work through. So we've got a bit of time to think through plausible near-term futures and get deliberation on those. And then there are some really big distributed issues where, in a sense, I think humanities scholars talk about sort of social imaginaries, where we're really having to kind of hypothesize and articulate potential broad futures, and that's a much bigger and more diffuse sort of exercise.
Great, thank you. Husayn, can I come on to you? Could you tell us a bit to begin with about what Onfido does and how applicable you think the technology that you have developed is when it comes to immunity certification?
Absolutely. Good afternoon, and I am glad this is being discussed just because it's both topical and important. I suppose at the outset I should say it's probably obvious that I'm not necessarily impartial to this. I'm part of a company that carries out identity verification. So should an immunity certification program proceed, we're possibly going to be involved, or companies like us would be involved. But having partly the technology experience and also being part of some of the conversations, and quite a few of the issues that were raised are interesting, which I can come on to. But as for what we do, we started 8 years ago. Our focus is around binding a person's physical identity to the digital identity. It's predominantly in a financial services application. So if you as an individual are registering for an online remittance platform or an online bank, you take a photo of your government ID and a short selfie video, and then we're using machine learning and AI to verify that it's a genuine government ID and that your face matches the photo, so that you can be onboarded onto that digital app. So that should an immunity passport or a health passport happen, then if it is the case that individuals have to self-test at home and be bound to some sort of digital app, as you could probably imagine, there's a need to bind that person's physical identity to that app, just so that they don't swap it or share it with a flatmate or a sibling, and that they have a presentable proof of that certificate if they want to go access a service or a building or something similar. Now, there are naturally 2 parts to this. There is a health-based app and binding your physical identity to the app, and then there's the app and binding that to some sort of testing and health certification or similar. So we're not involved in the testing or anything like that, but if any of these initiatives proceed, we play a role, given our expertise is predominantly around the identity side. And so with that background, and given the many great points that have been raised by Jonathan and Claire, that there are quite a few in there. But as a starting point around some of the, I suppose, concerns around this, and there are legitimate concerns, the need to oversimplify a result to make it a yes or no, part of that is necessary so that it's accessible and it becomes an easily presentable certificate. Naturally, there is no binary results in science more generally. This is predominantly probabilistic. So the intention ought to be that as the accuracy of these tests become high enough, we as a society may decide that it is worthy of attaching that to some sort of presentable proof of immunity. Isn't the right word, just because we all know this is no guarantee of indefinite immunity, but of a health status, at least for a period of time. So in Chile, for instance, they have a 3-month timestamp associated with test results. There was this notion of how enduring is immunity, and the challenges with calling it immunity, and increasingly it's being called a health passport as opposed to an immunity passport, in part because, as both Jonathan and Claire mentioned, around the World Health Organization has said that specifically they don't encourage immunity passports, partly because there is no certainty in the immunity of any sort of tests as it stands, and that's very accurate. But what we do know so far, having sort of been in this pandemic for about 4 months, there seems to be strong evidence that those who've had it over the last 4 months don't seem to be getting it again. Now, we won't naturally know whether immunity lasts for 6, 12, 18 months or so until that period of time passes. But at least in the short term, there is more evidence to suggest that people who've had it don't seem to be getting it again. And that in itself maybe have its advantages. Should we have a system whereby those who've had it are able to signal that effectively, even if it's only for 3 months? Are we better off enabling, whether that's for travel or to assist with the relief efforts or even going back to work, whether that would help? There was a very clear and an important question around potential stigmas associated with those who have are part of this sort of certification system and those are not. And that is something important to both consider and think about. And therefore, as the good report has outlined, there are certain things to bear in mind and how these programs are run and how considerations for it to be both inclusive, accessible, and so on ought to be thought of should these programs go ahead. Naturally, the political challenge is a key question. That Claire mentioned around the effectiveness of these tests. And yeah, that is continues to be a debate. And not a debate, but it's continuing to improve, and it's no medication is 100% certain. But the question becomes, in an environment of alternatives and risks, what measures ought to be taken or could be taken to help alleviate some of those both concerns and risks? Data sharing is another one, and that is where we particularly are, I suppose, both vocal and relevant, in that should such a system exist, then ideally it should not be abused. And therefore, if there is some sort of app where a person's health certificates are on there or their health status, and they want to show that to other organizations, then that ought to be just a yes, no, or essentially that should not attach any personal information. And what we have shown with the way that we approach our technology is that should an individual have such an app, and as they need to show that wherever they go, such as entering a care home, for instance, at the reception desk, that receptionist would only ever see a yes or no, and no personal information, be it date of birth, address, or anything else. And that is crucial to ensure that there is no risk of an abuse of the system post-COVID, or generally surveillance concerns and all those very legitimate issues. There is a question, I suppose, Jonathan ended with consideration for mitigations and what are the alternatives, and Claire touched upon that a little bit. If we consider that we're living in a suboptimal state and this COVID-19 is a deadly disease, then whatever proposals are considered ought to be considered in relative terms and what alternatives could be. Because we have experimented with them, and we're still in mass quarantine, and how sustainable that might be in the long term. So if we know that, say, I'm just a complete estimate, around 10% of the population have had the virus, now seem to be immune, at least for a few months, and therefore have a lower risk, far lower risk of catching the disease again. Should they be in any way treated differently to the other 90% who don't? I.e., if there's a care worker to go into a care home, is there any benefit to society of the individual in the 10%, i.e. with antibodies being able to go back and or go in a higher risk scenario? It's naturally not just those who have had the virus and have recovered. The hope is that we will get to a vaccine at some point. And we all know that administering a vaccination program may take months. So should we proceed with a full quarantine program until the very last person has had a vaccine? Or is there an approach where the 10% can become 20, 30, 40, 50%, and eventually proceed in that sense? Social distancing is another measure that has been tried and should continue to be tried, but it's not a foolproof system, and it has challenges. Most of the efforts have predominantly been reactive ones, and should there be more proactive options around, there is a group A who seem to have a lower risk because they've already had the virus and have recovered, being able to signal that, and others taking extra care, for instance. And lastly, the potential of there's always everyone that is focusing and hoping that it'll go away, but it may be prudent to plan for a scenario where that doesn't happen. what happens if this is a 2-year thing, a 5-year thing, or a 10-year thing? And what we know now is that it is a deadly disease and highly contagious. And so it's within that sort of frame as to what would be the thresholds and how could technology, more importantly, be used to mitigate risks so that such a potential presentable proof of health status can be shown. One last point to end on is not, I know the focus here is predominant on immunity and as to whether you seem to be having antibodies or not, but it can apply, a health passport can apply to whether you've recently been tested and whether you seem to have the virus right now. And that's specifically relevant for traveling. So if someone wants to fly from France to the UK, they've had a test in France that suggests on that day they don't have the virus. As they land in the UK, there may be benefit in them being able to present a health status to say, as far as today goes, I have a day pass, or I have some proof that I've just been tested and I don't seem to have the virus, or I don't seem to be carrying it at least today. There are benefits of that as well. This last point that is becoming more topical is the principle of least restrictive alternative, where essentially you have group A who have had the virus and have now recovered. Let's just guess and assume that that's 10%. And you have group B who've not yet had the virus. And in a situation of full lockdown, where, for example, no one is able to visit a care home, then those, as a thought exercise, with a presentable proof of their health status, group A, they could visit that care home in a safe way. And crucially, it wouldn't make anyone in group B any worse off. The 90% who don't have this health status, it wouldn't make them any worse off, because under a full lockdown, no one is able to access a care home. And not only that, but individuals in group B could be better off as well. So if you're an elderly, vulnerable person, then knowing that someone with a health license is coming to care for you, even though you are group B and that person is from group A, you as a group B person are potentially better off. And these scenarios can extend into, should we have gyms that are fully in lockdown, or areas where there's no social distancing? Or could we have a system whereby we get life back on track as far as possible, but in a healthier way? So I know that covered quite a bit, but that is a bit of an overview.
Wonderful. Thank you very much, Husayn. I'm going to ask some follow-up questions now, and I'd like to start with you, Claire, if I could. Two of the recommendations that came out of the Ada Lovelace report that Carly was talking about earlier was one that we ought to establish a group of advisors for technology in emergencies, which they come up with the acronym GATE. We ought to have a gate through which people go when they are developing new technologies in emergencies, rather than just this kind of knee-jerk response, we have to do something now. And the second is that if we are going to go down this route, that we really need primary legislation to give it that kind of legislative basis, which would inject societal trust that this had been duly considered and therefore was worth implementing. What do you think of those two proposals specifically?
So starting with the second one first, I mean, I think that everything that you've been hearing so far says that we're talking about, in this specific discussion around immunity passports or certificates, we're talking about something where neither the science nor the technology is yet established. So it would be very hard to create primary legislation specifically for this set of proposals in any way that could really be robust, because we don't yet know what we're talking about. So I kind of would like to put that. I think there are other issues that the Ada Lovelace Institute may have had in mind, but I think for this, we're not at the stage where we know exactly what we're talking about. And you need to know exactly what you're talking about if you want primary legislation, because it's hard to get and hard to undo. And that's part of its purpose. In terms of the advisory group, we definitely see that political decisions, policy decisions are better made when they're properly advised. So far, the different sorts of decisions have been so different that a kind of generic group that might be for all emerging technologies, I think, has proved hard to imagine. So if you take, for example, a very different field, but stem cell technologies and what the Human Fertilization and Embryology Authority has been doing for many years, which is negotiating scientific uncertainty, values-based patient interests, all sorts of really sensitive things with a degree of robustness. And that really suits that technology and the way in which it emerges. So it's hard to think of a single group that could do all of that for everything. For the application of AI in the context of COVID-19 and tracking systems more generally, then I think, yes, having some sort of mechanism that's continuously visible, that is helping to inform as things develop and also as they go wrong, which they will, but that part of the confidence building is to show that you're there and ready to spot it and can advise accordingly. So something of that kind of sustained nature will probably be part of getting everybody to both feel trusting in a system and also for it genuinely to be trustworthy.
And as you're saying earlier about the work that you were doing with the Royal Society, very often when you involve the public, they come up with incredibly nuanced, sophisticated understanding. Yeah. It would be great to inject that into the policy debate as well, not necessarily just have the experts in the field who are talking to government. Jonathan, can I bring you in on this point as well, on the point of kind of data discrimination and the need for legislation? What's your view on this?
So I think there are sort of two dimensions where we should think about whether legislation is needed. And we know that legislation can be passed really quickly when there's a political will to do it. We have very wide-ranging regulations on COVID. We have a Coronavirus Act. I think the first is the discrimination questions. And we should be able to ask ourselves whether or not a relatively small legislative step about making COVID status a protected characteristic might go quite a long way to offsetting the sorts of concerns that I alluded to. The Human Genetics Commission, which I chaired some years ago, kept prompting government to make genetic status a protected characteristic, as the USA has done, to offset some of the challenges about employers wanting to know genetic status even when it had no impact on their work, and in the insurance industry. And government resisted that on the basis that it was already covered by generic discrimination provisions. But actually that could be quite a simple step that would increase public confidence. The other key thing I think is about trustworthy data stewardship. As you would expect in an emergency, there's a proliferation of technologies that gather varying degrees of sensitive data to try and get to the bottom of what's going on and to offer innovative solutions. And one of the confidence building elements is that the holding of that data is well governed. And I think that would be a step that could be done relatively easily and would help us get focused on what really makes a difference and not get sucked into questions about broader privacy concerns that could be headed off if we had a good legislative framework.
Yeah. Could I just follow up on that? I mean, a number of companies are obviously very concerned to protect their staff. They don't want infected people coming into their headquarters and infecting other people. And some of these companies are suggesting that the apps that they produce should be mandatory for their employees. What do you think of that? Do the same legislation apply to them as to everybody else, or are there specific areas that we ought to be focusing on when it comes to employers?
Well, I think we should be really worried about the extent to which there's genuine choice. So if there is so if you take an example like pilots, it seems very proper that you have some health testing of pilots to try and make sure that they can do their job safely. If they are under the influence of illicit substances, then they don't just put their own selves at risk, but they put all their passengers at risk as well. There's clearly a common interest in that being safe. Now, one of the challenges of COVID, of course, is that a lot of the transmission is pre-symptomatic. So we might lull ourselves into a false sense of security if we just focused it on immune status. But actually, one of the opportunities here might be the use of artificial intelligence to stratify risk in a much more careful and sophisticated way. And if employers respond to that by looking at working practices, so are there some high-risk areas where you need close contact in order to be able to do the job, and therefore you need careful risk stratification, versus other areas such as maybe staff canteens where you could have deliveries to desks rather than people coming together. If you're using it intelligently as a risk stratification and you do that with agreement and discussion with staff side, then that would seem to take us in a very positive direction. If on the other hand it's used to keep some people away from the workplace who want to be there, or to restrict their ability to make a livelihood, that's when you need the anti-discrimination provision. So it's not straightforward, it's complex, and there would be opportunities to improve our learning about how to stratify risk. Okay.
Husayn, I wondered if I could come back to you. We've talked a lot about, quite rightly, about a lot of the concerns with this technology and the legislative framework in which it exists. But I wondered if I could draw you out a bit more about the opportunities that there are in healthcare data, because I think we'd all agree that there are phenomenal opportunities if we can get the data governance regimes right to use health data in a way that would be very beneficial both for the individuals and for collectively in a situation of a pandemic as well. Do you have further thoughts about the data stewardship regime that Jonathan was alluding to? What are the best methods of preserving data rights in this kind of world?
So it depends on the country. We're fortunate in that we have a National Health Service in the UK, and the National Health Service has and holds almost everyone's data, and everyone who's registered anyway. And so that is beneficial because should a program proceed in the UK with the health record staying always with the NHS, and then the individual could provision access to their health status to any organization that requests it if they want to gain access to a service, go to work or go work on the front line, for instance. And they would only need to really share a yes/no response on their health status, knowing that there's a standard here that the health service of that country, in this example, the NHS, for example, could sort of endorse. The broader question, as far as regulation goes, is, I suppose, a follow-on on Jonathan's around risks of abuse. So there is the reports that have come out in the last few months, we all kind of know that those who are on higher incomes are able to take time off work and predominantly work in higher skilled sectors where they can work from home. The unfortunate situation here is that those are from lower incomes, specifically poor individuals, who have to take the risk and go out and work, especially in a lot of the frontline occupations. And the challenge there is that these individuals, if economically they can't sustain themselves, they're just weighing up, do I have to essentially go hungry and take that risk, or do I go out and risk infecting others because I feel unwell, but I still need to it's a lower risk than going hungry. And so the challenge with any program that doesn't have strong regulation and government involvement is that you could have an employer in a scenario, if it's a warehouse employer, for example, where there's a significantly greater supply of workers who want to work compared to the demand, they could then segment and say, okay, I only want the population who can confirm that they have some sort of health status to suggest that they don't have, they've either had the virus and have recovered from it, or they don't have the virus today when they show up to work. And you can imagine that would be a very seriously, both ethically questionable and dangerous scenario to be in. That's why a lot of these policies of both social care and any notion of a health license or immunity certification kind of should go hand in hand.
Okay. Claire, could I come back to you and this whole risk of discrimination, which I think you have all been talking about in different ways. How do you think that is best addressed?
So I was thinking as listening to Husayn that in a sense what we're talking about is a classic policy problem, which is using evidence that's always, if it's observational, about the past to inform decisions which in what we care about is all about the future. And there are two things, to hold on to in doing that, knowing that you can't predict and you can't control the future, but you can do more than just kind of incrementally step into it. One of them is the business of knowing or thinking about parallel paths. So it's very easy in policy to sort of have to jump from not doing anything to must do something, and there's a particular option on the table, and that's the one which is analysed. But in fact, you're always looking at least two paths, and the more paths that the more you can incorporate a discussion about alternatives into that thinking, then the more you'll get a fully reasoned debate and hopefully decision. But the other is that doing that also helps with I think what is partly behind the questions around discrimination, which is kind of unintended consequences. Nobody, I'm sure, is going to set out to be discriminatory. Some of it will emerge, if it does, because it hasn't been foreseen. So the more engagement, it goes back a little bit to the point earlier about advisory groups and about public engagement. Experts actually don't always spot all the unintended effects, however hard they try, with kind of messy, complicated social systems. The more brains and minds you can get thinking about what if, how would it work if, what would it feel like if it was in my workplace, or it was my children and my school, or all sorts of different settings, the more likely you are to spot how different sorts of discrimination might emerge. And that might actually be not only kind of quantitatively what types of people, but also you would begin to get a sense of the language and the kind of more effective discussion around it, which is also really important in the long run to getting stability and confidence.
Okay, great. We must end it very soon, but Jonathan, I'd like to give you the final question, which is who is doing this well around the world? When you're looking at the kind of stewardship regimes, the legislative frameworks for all of this, where are people doing this well in the world that you think we could learn from in Britain?
Well, I think it's easier to answer the question where we can learn from than it is to identify who is doing well, because it is such a complex set of circumstances. So if you look at what the Australians have been setting out to do, they have a relatively low rate of infection. They've used an app which takes a lot of personal data and tries to help it support contact tracing. Now, if you're able to think about the problem of COVID-19 as essentially a set of outbreaks where what you're trying to do is to close them down before they spread, then all the support you get in terms of increasing the speed of contact tracing makes a lot of sense. If, on the other hand, you are looking at a context where there's widespread infection, where you can't really know who's got it, you're not so much talking about trying to protect us against people who are infectious as about how you escape from lockdown. So the point Husayn made about, could this be a stepping stone that enables us to gradually unlock lockdown? To make that effective, you need to make sure there's a pathway that benefits everybody. So if you're going to use immunity passports, you might do that as a first step as you build up widespread community testing. And you have a vaccine coming on stream, you think, well, everybody gets to immunity eventually, so it doesn't worry quite so much that the pace is different, particularly if you make sure there's good protections for people who are in the slow lane. I don't think anywhere has really cracked that, because we just don't know enough yet about the virus, but it's all dependent on the context in which we are working.
Right. Wonderful. Thank you very much, Jonathan, Claire and Husayn. That was a really stimulating debate, I think. I think we concluded that the science and technology are still in a state of evolution, and we ought to be very careful how fast we move in this direction. I'm going to pass back now to Carly, and then we will have some questions to follow. Carly.
Thank you so much, John. And thank you, Husayn, Jonathan, and Claire, for a fascinating discussion. I really appreciated having such diverse sets of expertise come at a really thorny issue such as immunity passports. So thank you for your thoughtful comments. And I was furiously taking notes on what Jonathan said about genetic discrimination. I think that there's something really important to be explored there. So hopefully we can continue that conversation. If you would like to continue the conversation with the panelists, you can do that in the Q&A breakout room, which I believe you can access through the main CogX portal if you just search for Q&As and the breakout room for this panel, which was called Exit Through the App Store. That will start in about 15 minutes. We'll let the panelists take a break, have a tea, and they will meet you there for Q&A shortly. Otherwise, you can stay here, and in 15 minutes, we'll start our next panel. We'll be looking at how lawyers and journalists come at the question of investigating and prosecuting AI systems. And that will start at 3 p.m. UK time, so 15 minutes time. Thank you all for joining us, and see you again soon.
Want access to more CogX videos? Subscribe now for free at cogx.co.